Is that we are recording this session so we can share it more broadly with those who couldn't be here today. But again, a huge welcome to Recovery Day on the Hill. My name is Wendy Jones. I am the Executive Director of Minnesota Recovery Connection. We were Minnesota's first recovery community organization. And we're so happy to be able to host Recovery Day on the Hill and to do that in collaboration with March. And my co-host today is John Magnuson, Executive Director of March. So John will have an opportunity to speak in just a few moments as well. As people are joining the meeting today, I see we've still got a lot of people entering into the event. I just want to give a little bit of an overview of what we will be doing today. So it's the annual Recovery Day on the Hill. This is an opportunity to really think about recovery in all of its shapes and forms. And just a reminder that recovery is a process of change. It's a process of change through which individuals improve their health and wellness, live a self-directed life, and strive to reach their full potential. And we want to honor and celebrate that recovery means different things to different people. And there is no wrong door to recovery. We're all here today because we are passionate about improving recovery outcomes, about celebrating recovery, about making recovery possible for all who seek it. And so as we talk today, I'd like us also to really think about each of us as a change maker. Often in the status quo, when someone is sick with substance use disorder, we take them out of the community in which they live or in which they do their work, move forward with their daily lives, and we try to heal them. We have a lot of really good treatment programs in Minnesota. Too often, though, when we give people back to their communities, those same circumstances that made a substance use disorder possible are still there. And so today, as we talk about the full continuum of care for recovery, we want to think about how can we treat the soil? How can we bring recovery everywhere and into our communities and change the systems so that when we work on healing people, we can bring them into a healthy environment where recovery is honored, recognized, and supported no matter where they are on their recovery journey. So thinking about treating the soil. And so today, the theme for the 2022 Recovery Day on the Hill is really about pathways to recovery across communities. You're going to hear speakers today, some legislators, community members, representatives of organizations, and we're really thinking about a person-centered continuum of care. What will it take to support recovery throughout someone's entire lifetime? We're going to hear speakers about culturally responsive recovery support, family recovery support services, recovery supportive housing, recovery community organizations, recovery support for justice-involved populations, and throughout all of this, supporting multiple pathways to recovery. So those are a few of the talking points for today's Recovery Day on the Hill. We also want to encourage you to advocate for what's important to you. These are just a few talking points, but we know that there are a lot of different perspectives in the audience today, a lot of passion. We hope that you will connect with your legislative representatives and leverage your voice as a constituent. Elected officials are responsive to constituent concerns, and they really do want to hear from you. So a real quick tip is when you contact your elected officials, put constituent in the email header and your zip code. And that's a real heads up that you are a constituent And it's just a way to help get your message across more quickly to your elected representatives. If you're not sure who your state senator or representative is, there is a link in this form that will take you to finding out who your elected representatives are. And I'm going to put, as soon as we have a few more people in the room, I'm going to put a link to this presentation in the chat, and we'll also send that out to you afterwards so that you can access these links. So a few of the speakers that we'll have today, a variety of members from the state legislature and community members. Really looking forward to having all of them join us in just a few minutes. And some of the issues that are particularly relevant for policy this year, I've attached links to two sort of core areas. One is March's background sheet for 2022, and March represents treatment providers and is really focused on the continuum of care in their policy efforts this year. And so both John Magnuson and Amy Delwell will have a chance to talk about that. I also included a link that gives more information about recovery community organizations and where they fit in the continuum of care. And that's a recurring theme on Recovery Day, in Recovery Day on the Hill, is those community-based recovery supports. So those two will be in your presentation, which we'll share in a moment. But before we begin, I would like to start Recovery Day on the Hill to honor and remember a remarkable recovery advocate. Many of us were close to Mark Johnigan. I had the pleasure of working with him, of learning from him, being mentored by him, being challenged by Mark. And I can't think of a single voice that has had more impact in recovery advocacy in the last few years than Mark. And we lost Mark last December. And I'd like to start our Recovery Day on the Hill by inviting Gregory Kemp from Twin Cities Recovery Project to say a few words about Mark and his advocacy and the legacy that he shares with all of Minnesota and beyond. Gregory is a board member at Twin Cities Recovery Project. And Gregory, if you're here, I'll invite you to turn on your microphone and say a few words. And I'm going to stop sharing my screen now, and I'll put this presentation in the chat with the links.
All right, good morning. Can everybody hear me?
Yes, thank you.
Okay. Good morning. My name is Gregory Kemp, and I am a person in long-term recovery. I'm also the program director at Twin City Recovery Project. And what that means to me is today I get to share about my CEO, Mark Johnigan. I'm just going to give you a little history and background about Mark and just tell everybody just who he was and what he meant to the community. Mark Johnigan was from Dayton, Ohio, moved to Minnesota in 2010 to change his life and become a better person. In 2019, Mark Johnigan opened the Twin City Recovery Project, a country-specific RCO, where his mission was to offer assistance and support to those who are or have been challenged by substance use disorder in their transition towards lifestyle of health and productivity, by offering prevention, intervention, recovery support services, and resources to develop the whole person. This will enable them to build healthy and positive relationships and to become productive members of society. Mark Johnigan sat on the following boards and worked with the following partners to support the work of TCRP and to help the recovery community he serves. He served on the Hazel and Betty Ford Foundation Advisory Council for the opioid epidemic in the African American community, the Minnesota Medication-Assisted Treatment, Prescription Drug, and Opioid Addiction Team. He was also an advisor to the Surgeon General on the national opioid epidemic and participated in a panel discussion to develop strategies to help prevent overdoses as advisor to James W. Carroll, the Drug Czar. In 2020, Mr. Johnigan participated as a keynote speaker at a recovery seminar at Metro State University, as well as being a presenter for the RX Drug Abuse and Heroin Summit. In December of 2020, he organized Boots on the Ground, a national virtual conference on community-based programming to reduce stigma and racial disparities in access to opioid use disorder services. As of 2021, Mark was a board member of March. These are some of the accomplishments of Mark L. Jonigan that are rarely seen by the recovery community. But there are also some accomplishments that sometimes go unnoticed. Mark repeatedly went out to the community and engaged with individuals who suffer from substance use and mental health. He met them exactly where they were at, loved on them, invited them to Twin City Recovery Project, trained them to become a CPRS, gave them a job. And today, I'm currently the program director at Twin City Recovery Project. This is only one of the miracles that Mark Jonigan had a hand in creating. There are countless lives that Mark touched. Through his philosophy of servant leadership and self-efficacy, he empowered individuals to be all they can be. Mark L. Jonigan is truly missed by the African-American community and also the recovery community. Words can't express the loss me and countless others feel. My goal is to carry on with Mark's dream and vision and continue to help TCRP provide services to individuals inside and outside the recovery community. If I can be half the man Mark Jonigan was, the world would be truly a better place. I just want to thank you for inviting me to speak. This is really emotional for me, but I think I did a good job of representing Mark Jonigan. So I want to say thank you.
Thank you so much, Mr. Kemp. Mark's legacy lives on here today. He lives on throughout Minnesota, and it's such an honor to have you here representing Mark and all of his work. I really appreciate you coming to say a few words about Mark. And I think that as we move forward today, Mark's work is an inspiration for all of us and for really changing the paradigm of what recovery can look like in Minnesota. Thank you, Mr. Kemp.
Thank you, Wendy.
I'd like to take a moment now, if we just want to sit for a few seconds of silence to remember and honor Mark Jonigan. Thank you, everyone. Mark was a giant, and his legacy is huge. And we'll move forward today in the spirit of Mark's work. And I would first like to turn it over to my colleague, John Magnuson, and have John say a few words about March. As Mr. Kemp mentioned, Mark was a board member at March. So John, would you like to say a few words?
Well, thank you, Wendy. And Mark was an incredible loss. And in fact, we at the legislature this year at the opening testimony, Amy gave our tribute to Mark there that, you know, our work this year is in dedication to his great service. And I got to say, if Mark Jonigan were in the room, it wouldn't have been quiet. So offer that for him. In great respect for him, because he truly was a ball of energy that we all loved and appreciated, not only for his message, but also just the spirit of the guy. Just wonderful, wonderful. So thank you, Wendy, for also the opportunity to partner with you. I hardly can say partner. Wendy does so much for our community, and March is supportive of everything that you're working on, and we're so grateful. Because if we don't have treatment outcomes, if we don't have community where people can adjust to life and recovery. And the reality is that we have learned so much more about addiction, substance use disorder, you know, the co-occurring, whatever you want to call it. We have learned so much about what we all care about, which is how we can help people. And that's what treatment providers are in the business of, is helping people with a substance use disorder that have those multiple co-occurring conditions find pathways into recovery that are supported by our community, because we don't get well alone. And that's something that we always all can agree. And March came together in its history as that entity that was supposed to be one voice that represented all of us. Well, obviously, we've grown quite a bit since the days and the founding of March. March can't be one voice for all of the people that are in this room. What March can do is help facilitate, through like our public policy forum, where we give an opportunity for the issues and the ideas of the day to come forward. We can use the industry muscle at the legislature to make sure that we actually get a continuum built out. But we can't do it alone. And that's why we've got multiple voices. MRC just is doing so much with all of the RCOs. And, March also recognized that as we are making this change take place, exponential change. I mean, oh my gosh, changes to 245G, which is the area of law where treatment is written, then adding in ASAM criteria through our work with the 1115, and let alone that we already had brought in direct access, making treatment more accessible and easy for people. This is what's all happening in the space of treatment, let alone the world of RCOs and our prevention efforts. And so what we've been really working on is alignment, value, and mission. How do we align to work through our providers to make sure that our patients are being taken care of first, that our professionals have the resources that they need to ensure that they can do the quality work that they're doing, and that our providers can keep the doors open, so that we can continue to have that leading edge that Minnesota has always brought to this world. And the way that March envisioned that was, there's a lot of change, a lot of disagreements. And so we tasked an innovation center to bring that forward. And part of that was the recognition that we needed to retool. We have everything that we're going to do is going to be in a digital format, so we can have access to it 24/7 on any device. That's a learning management system, and that's where and how we're delivering our content. But we also know, especially through the pandemic, that gathering in person is vitally important to being human, and especially important to people that are dealing with substance use disorder and mental health. And so we've retooled our events. Our State of the State is a time to gather here where we are as a state. Then we have our leadership retreat, which is the leaders of the field and the partners in the continuum come together for 2 days and take a deep dive into where are we, taking stock of what we need to do and to move the field forward. And then we have our summer event, which is our Shared Solutions Summit. That's more of like a salon style, where we have national people talking about the cutting edge issues that are coming forward and allowing you to become part of the dialogue in breakout sessions. And then, of course, the granddaddy of the entire Midwest, the March annual conference, and now Expo. While we have all pathways to recovery assembled for 3 days in the St. Paul River Center, why aren't we opening that up to the public to invite them in to learn about the pathways of recovery? So we are really excited that now all of you can buy a 1-day pass to the March annual conference, and we can, invite HR professionals, people in schools, all the other areas where they may not need professional education, but they certainly need education around our issues. So a lot going on in the world of March, but one of the things is driving at the legislature. And we have a government affairs committee and Amy Delwo was a past co-chair and is also now next in line to be the president of our board. So I'm going to turn it over to Amy to tell you about our patient-centered approach that we took this session. Amy.
Thank you, John, and welcome everyone today. Thank you so much for joining us and to join us in the message of recovery. John mentioned that we have a bill before the legislature. So it's House File 3414, carried by Representative Frederick, and Senate File 3062, carried by Senator Wickland. And there's 3 parts, if you will, to this bill. We focused on patients and largely the need for recovery capital, and then workforce and professionals. And so today I'd like to highlight just a few of the things in the bill. that I think are most relevant to this particular audience. Something that reminded me once again of Mark is Mark was always on the street helping anybody, anywhere. Like, I'm sure that most of Minneapolis has his telephone number. There's like 1 degree of separation between Mark Jonigan and everyone else. And so with that, we had connected with about 400 patients that were in treatment to ask, what is it that you need in order to continue your journey of recovery? And here's some of the things that we heard that are in our first article of our bill that identifies substance use disorder as a chronic disease and the need for the scaffolding, if you will, to build recovery capital. So first, there is a housing fidelity bond idea. So that is for those who have maybe a rental history or a lack of rental history, or perhaps they have a criminal justice involvement in the past. And what this would do is provide them with a fidelity bond between $5,000 and $25,000 for 6 months up to a year, so that they have a better chance at getting rental housing. It also waives the fees for birth certificates and driver's license, particularly for those individuals that are medical assistance eligible. In addition to that, it sets forth a braided service structure. It's a follow-up set of services. What we heard from people is the major things that they're needing after treatment is access to housing and a way to help pay for the housing, that they need transportation that isn't specifically tethered to medical assistance, that they need childcare, and they need food. Those are some basic items, but necessary recovery capital. And so we braided a service package for people that post-treatment, once they've been discharged from treatment, that they would gain access to that braided service package. We've also heard from people that they would like to be able to connect with their counselor periodically for a check-in after they've been in treatment. And so we're eliminating some of the logistic and administrative barriers that keep people from doing that once they've been discharged. And finally, we're trying to diversify a little bit some of the guest speakers that people are able to have in group. And so, for example, not all counselors are actually in recovery. And so to have somebody come and present about their recovery experience. Now, right now, they can have somebody show a TED Talk and allow someone to come in and share their recovery story that way, but they can't actually bring TED into the room to have the discussion. And so we want to broaden that a little bit. And in terms of our professionals, they are so essential to the recovery process. And so one of the things that we're doing is we worked with the Board of Behavioral Health Therapy to provide a window whereby our interns who've been working in the treatment space are able to continue to do so for 90 days while their actual license becomes approved by the Behavioral Health Therapy Board. And then in addition to that, we're trying to reduce some of the pressures and burdens in terms of documentation. And I'll highlight a couple of those. One is that we want to make sure when there's a major incident, the department licensing rules require professionals to immediately document that. And so sometimes if you're in a residential site, et cetera, there's a lot going on to manage an emergent issue. And so this allows them 24 hours to do that documentation. So it's close to the time, but allows them to perhaps go home, get some sleep, and come back and refresh to do that documentation. And another place that we've heard from our professionals is that treatment plan reviews. Right now, they're required on a weekly basis. And what we're recommending here is that a treatment plan review occur on a monthly basis, and that if a significant event occurs, of course, then it will happen sooner than that. But allowing those professionals to spend more time with clients as opposed to working on some paperwork. So I want to just extend a thank you to both the House and the Senate. They provided informational hearing on this bill back in February in the House on February 9th and in the Senate on February 10th. And in fact, then earlier this week, Senator Abler provided a formal hearing on the bill. So we're grateful that this bill continues to gain some traction. And with that, I will turn it back over to you, Wendy. Thank you for your time today.
Thank you so much, Amy, and thank you, John, and thank you both for all the work that you're doing, and really an honor to collaborate with you on a variety of recovery issues. We'd like to bring in some voices from the legislature and from the community. I'm just going to do a quick check. Is Representative Baker here by chance yet?
I am here, Wendy.
Ah, great. Representative Baker, you've been such a supporter of the recovery community and recovery issues, and I'm really glad you can be here. Would love to have you say a few words.
You know, real briefly, thank you, Wendy, for doing this. And again, I am so proud of people in recovery that, again, normally don't wear it on their sleeves. They just go through everyday life. And I will tell you the current work that our friends at March and all the communities that are doing to bring some, I think, some real valid legislative adjustments this year. I'm really happy with a lot of what this attempt is this year. So I'm working closely with our chair, Peter Fisher in the House. We had a great informational hearing. I'm very supportive of the bill. Tomorrow, Wendy, and to others, again, there's moments of time when you have to, self-reflect. But tomorrow's 11 years for my son that passed away. And for me, it's not that moment that you looking for any kind of a moment or anything. You just, what you want to do is you want to share that the people that are in recovery are winners, and they're showing there's hope. And this horrible disease of addiction is something that I will continue to fight and beat back as much as I can. But we have to do it in a way that we get the supporters around us behind us. So again, I just want to say that we are here ready to help in any way that we can that makes sense. I'll continue to work on good legislation that continues to bring us a full circle of services, whether it's residential treatment, whether it's outpatient, whether it's getting naloxone in areas so we have a chance to save people that will be saved and be in recovery later on. There's no judgment here with certain people that understand this disease that so many don't yet get it. And so I'll continue to do that while I'm here. If my voters have me come back in November, December next year, I'll continue that journey as hard as I can. But I just can't thank enough the folks that are working this thing every single day to save people's lives. And I'm proud to be my third year now going into the ORAC community, which is this Opioid Epidemic Response Council. We want to be this really strong sounding board for the rest of the state. So so much to do, so many needs for our experts like you, Wendy, in the field, and others that are helping us get this figured out. And just again, pleased and proud that I can support you guys in any way that I can. So thank you again for allowing me to speak just for a couple minutes.
Thank you so much, Representative Baker. It's always an honor to have you here. And
Thank you.
Thank you for turning your pain and loss into such a strong commitment to help so many people. We really, we're grateful every day for all that you do for the recovery community. So,
well, Wendy, this is my recovery. This is how I recover. And this is what I do. And so many of your folks are there to tell their story directly, but this is my story. So God bless everybody. Thank you.
Thank you, Representative Baker. We have another. You'd think I'd learned to unmute after 2 years of the pandemic. I want to invite we have another legislative voice here. Representative Hassan, are you in the room? I think you were here. Is Representative Hassan here? Oh, she's left. Okay, I am going to invite Fahia Budul then to say a few words. One of the themes of this of our recovery work is making sure that all voices are at the table and recognizing that there are different needs within different communities. And I'm really grateful for the work that Fahia is doing with NIA Recovery Initiative and others. And Fahia, are you here? Would you like to say a few words?
Yes, thank you so much, Wendy. Hello, everyone. I'm so glad to be here with all of you. My name is Farhia Budul, and I'm a woman in long-term recovery. What this means to me is that I can be my authentic self, and recovery gave me back the values and my traditions. Alhamdulillah. I'm so excited to be here with all of you. Thank you so much for showing up for recovery. I'm asking legislators to support culturally responsive recovery support, something that is new and desperately needed. Substance use disorders have really ravaged Minnesota's East African communities, which is largely a crisis that's unseen and unaddressed. The Near Recovery Initiative is a powerful tool that can really beat back this epidemic in my community with the opioids. When I founded NIA last year, it's still the first recovery community organization in the nation that's really tailored to the culturally and social traditions of my community for more than 60,000 East Africans who've made Minnesota their home. We don't really make no mistake, but even as the nation continues to be overwhelmed by addiction to opioids, alcohol, and other substances, there has been little acknowledgement that those outbreaks have really hit East Africans particularly really hard. The shame, the stigma, ignorance, and the denial of substance use disorders have really contributed to the overdoses, crime, and misery in a community that has been largely invisible to most Minnesotans. So that must stop. And NIA can really make that happen. Both with my own personal and professional experiences have really prompted me to create NIA. My family escaped Somalia's civil war when I was 7 years old, and I found a new life in Minnesota. And as a young adult, I nearly lost it all to my own substance use disorder. After attaining and really working in recovery and really attaining the long-term recovery, I decided to share that healing and hope that I have found with others. I look forward to bridging the gap with all of you in the recovery communities, to the East African homes and communities across the state. We have Somalis today here representing St. Cloud. That's amazing. And so the Hoyos, which is a Somali word for moms, where we're here to let them also know that we're here for you, Hoyos. There are few Hoyos in here in this room today. And we want to say we are here for you and that you're not forgotten. And thank you so much for all of you for being here with all of us and showing support for recovery. Thanks.
Thank you so much, Fahia, and for your passion and the work that you're doing. And I know that when Representative Hassan pops in, we'll have her say a few words. I'll just give a call out there one more time if she happens to be here. We'll stay tuned. So the need for culturally specific, culturally relevant recovery support is greater than ever. We saw the image before of the tree growing out of the soil. And that's what culturally relevant recovery support is tapping into that strength in the soil and helping that grow. And we're also excited, is Bobby Eagle here? Bobby, are you in the room? You are, there you are. All right. I'd like to, hopefully your connection is okay there, Bobby. Bobby is a cultural advisor for the Mille Band of Ojibwe. And Bobby, would you like to share a few words?
Absolutely. First of all, Buju, Ogmaganu Indigenous Cause, Magizi Indu Dame, Mizaga Gini Indu Njba. My name is Bobby Eagle. I'm a member of the Mille Band of Ojibwe, and I live on the Mille Indian Reservation. I've worked for Four Winds Lodge, our tribally treatment facility, as a cultural advisor for the last 4 years. I'm also a father of 5 children and have 1 grandson. Aside from my day-to-day job as a cultural advisor, I attend ceremonial dances throughout Minnesota and Wisconsin. I also facilitate sweat lodges, ceremonies for our community. About 3 years ago, about 3 years ago, some community men and I started a men's empowerment group where men from the community come together for a weekly talking circle. We also plan fundraisers and do positive engagements as a part of our mission to help create healthy community. It's through this work that I've discovered that the common denominator and underlying issue to alcoholism and addiction for me and many others is grief and trauma. And that addiction is a symptom of that. It was the late Art Holmes that said, in all his years of working with alcoholism, the only thing he would change is that he would address grief and trauma first. As an Anishinaabe man in long-term recovery, I bring lifelong knowledge and firsthand experience to the table when dealing with this brutal disease called addiction. I've tried numerous times to put the drugs and alcohol down, but it wasn't until I was able to get totally honest with myself. That meant addressing the unresolved grief and trauma that plagued me for many years. I'm happy to report that it's been 9 years and 3 months since my last use. In closing, I just ask that everybody considers my thoughts and experiences when it comes to making decisions about how we treat alcoholism and addiction going forward. Please treat the grief and trauma first. Thank you very much.
Thank you so much, Bobby. I really appreciate you being here today. Thank you for the wonderful work that you're doing and for bringing the strength of the Anishinaabe culture to the forefront and fighting the good fight. And you've got some really powerful reminders of the grief and trauma that is part of what we're trying to heal in the recovery process. Thank you, Bobby. Thank you so much for being here. I would like next to, I thought Senator Eaton was here. Senator
I'm
Eaton?
here.
You are, yay, all right. Senator Eaton, we want to give you a few moments to speak. And I first want to thank you for your many years of service in the state legislature. I understand that this is your last term.
Yes.
And there are so many aspects of where we are today that we wouldn't be here today if it wasn't for you, particularly around the work addressing the opioid epidemic and other legislation. And so I just wish everybody would give a big round of applause to thank Senator Eaton for her work and turn it over to you, Senator Eaton, to say a few words.
Well, thank you so much. I appreciate that, Wendy. It's been a team effort. There have been a lot of us who've worked together on a lot of issues. I come to this as a person in long-term recovery. I think 36 years. And it's been a journey. And from what I've heard people talking about, we all have a similar story. And I'm hoping that we can do more to take some of the stigma and some, that's other than addiction, that's what killed my daughter, is that she was afraid to tell me that she had become addicted to opioids. So she tried to get help herself, but she didn't have insurance. So eventually she got an overdose and died. That was in 2007. So that kind of motivated a lot of my work around opioids. Unfortunately, the stigma is still there, and now we have all the fentanyl in the mix, but we're still working hard. Representative Baker, who also lost his son, and myself have worked hard with the ORAC, the Opioid Epidemic Response Advisory Council, and now we have money coming in from the settlement, and we're working on an updated bill for that so that 3/4 of that money can go right to the communities. It doesn't have to go through the state with grants and all that. So, and I think we've come to an agreement on that. So that should happen pretty quickly. And we're also trying to update Steve's law to make people more likely to use it, that with the protections that are in the law for if you call 911 and when someone's overdosing, that you would not be charged with a crime for the drugs or paraphernalia on the site. Some law enforcement have been trying to do some workarounds on a lot of that, so people are less likely to call. And so we're trying to tighten that up. And I've been working with the Steve Rumler Hope Network, Alicia, with that. And I'm still working on trying to get a department or somebody to pay attention to us in DHS so that we are not at the kind of an afterthought in all the stuff they do. Addiction is real, and as everybody's acknowledging after the pandemic, people really got into a lot of trouble with alcohol in particular, and now with opioids. And so we have work to do, but and I'm not going anywhere other than I won't be a senator. So I will still continue in this field. It's an important part of my program in retaining my sobriety. So thank you for an opportunity to speak.
Thank you so much, Senator Eaton. Congratulations on a wonderful career in the Senate, and we look forward to seeing what's next and how you will be advocating for recovery in the next chapter. And like Representative Baker, taking the pain and turning that into a lifetime of advocacy that has helped so many people. We really appreciate everything that you've done. So thank you. I would like to turn next to, who do I have on the list here? I believe we have Pam Lanhart available from Thrive Family Recovery Support Services. And we've had many speakers who have addressed the issue of families and family recovery. And families are such a critical component of the continuum of care. And I would love for Pam to say a few words right now about her work in supporting families and other issues that are important to her. Pam, are you here?
I am.
All
Thank
right.
you, Wendy. I appreciate that. My name is Pam Lanhard. I'm the founder and director of Thrive Family Recovery Resources, and I am a person in long-term recovery from the effects of the disease of addiction. And what that means to me is that in spite of growing up in a family where substance use was prevalent, having parents and siblings, and a child that suffered from the disease, I was able to activate my own recovery so that I could do my part to break the generational cycle of addiction. It means that I can be present for my husband, my children, and my grandchildren. It means that I can work in my community for other families that are suffering. And most importantly, what it means to me today is that in this moment, that I am able to speak to you as a healthy, recovered person in spite of suffering the worst loss imaginable. The loss of my son, Jake, who struggled for over 10 years battling substance use, activating recovery, yet succumbing to the disease on October 23rd. I want to start by sharing this story of two children. First, my third child, Jake, who struggled at a very young age with substance use. And second, my child, Nikki, who at a very young age struggled with depression, anxiety, and self-harm. In 2013, when my daughter presented with her mental health issues, we got a very nice call from the school about her struggles. We had meetings with the guidance counselors. We were referred to both school and community therapists. We were given a bag of brochures and resources for our daughter, and she was immediately referred to a learning specialist to get an individual education plan. Lots of compassion, lots of guidance, and some good support. Also in 2013, when my son presented with substance use, he was suspended from school for 5 days, and we were told it was our problem. We were not given resources. We were not given help. We were shamed. We were told that we were bad parents. We were told that our son's disease was a sin, that it was a moral issue, and that we just needed to parent him out of it. Even after he had his first treatment experience, where we were simply told to just go to a meeting. So I walked into my first meeting when my son was 15 years old. They decided to call him an addict, and they were told that I was told that I must detach, disconnect. There was nothing I could do, and that I had to wait for my son to hit rock bottom. We were automatically, without merit, labeled as codependent and enablers for wanting to help our son. Well, my daughter was led to evidence-based family therapy and practices like DBT and CBT, and we were equipped with skills-based solutions. For our son, we were told that if we had trouble, we should just call the police. And it was obvious to me that the shame and stigma of addiction, along with archaic ideology, prevented families from getting the help that they needed. And I began to wonder why. Why, when we know that if someone is presenting with mental health issues, with heart disease, with cancer, or with other chronic illnesses, where early intervention always improves outcomes, families who were struggling with someone that had substance use disorder were told that they had to wait until their loved one was in an acute state of the disease before they could get help. Intuitively, I knew that there had to be a better way for families to recover together. My life changed in 2016 when I attended the local peer recovery training at MRC. And at first I was almost angry that families weren't given this kind of evidence-based help that they needed in order to interact effectively with their loved ones. I began to wonder why, if holistic recovery worked for someone using substances, were families not being helped in that same way? Why were we not being informed and educated by the stages of change, the 8 dimensions of wellness, the 4 pillars of recovery, harm reduction, and multiple pathways? What was especially disturbing is that the average length of use for someone suffering is 10 years. That means that families, in large part, go unsupported for almost a decade until their person activates treatment and they might get a little bit of help. Add to this the stigma, the shame, and the anonymity of the disease. And it's clear that we're dealing with a lot of families that are suffering right along with their children or loved ones. So here we are in 2020, and are things getting better for those activating recovery? Absolutely. Wendy mentioned, we now have direct access and special funding for treatment. We have an incredibly robust peer recovery movement and recovery community. It's actually amazing. And yet every day I get calls from families who feel unsupported. And if we look at the data shows that there are 70 million family members affected by substance use disorder in our country. Now, also, according to Google, only about 300,000 of those attend any type of support groups in the US. And support, as we know, is just one component of holistic recovery. Families are often vilified as being part of the problem. They're labeled, they're blocked out of the treatment and recovery process, and they're not appreciated as one of the most critical and integral parts of successful long-term recovery. Yet we know that when families are equipped with evidence-based, actionable solutions, that the length of use can be shortened by almost 65%. In the work that we're doing at Thrive, families in our organization are not just being supported. We're currently providing over 100 individuals with peer coaching for their families in a program that we just launched in September. We're helping families navigate ethical resources regardless of their financial means. We're offering low cost or no cost educational workshops to families that help them move from chaos and conflict to help them take a more compassionate, collaborative approach to change outcomes. We're working with community partners and providers to help educate them on how they can work with their families more effectively using evidence-based best practices. We're doing away with language that causes harm. We're doing away with words like rock bottom, detachment, disconnection, and tough love. And we're removing shaming labels like addict and alcoholic. We are shifting the narrative to one that is supportive, positive, person-centered, and offer help, true help. We're helping to create healthy family ecosystems. As Wendy mentioned, creating fertile ground in a way that creates the conditions to support recovery from pre-use to remission of the disease. No doubt we've only just begun to really truly engage families in the process of recovery, and yet we have begun. I want to assure you that we have begun. And my hope for the next year is that by assisting families in leading the way with their own personal recovery, that we can reduce harm in our communities, that we can guide a record number of people to evidence-based help for their disease, that we can begin to look at the continuum of care as you would any other long-term chronic disease. And most importantly, that we would reduce the number of our loved ones dying. Our motto at Thrive is that families matter. And my call to action for each one of you today is to remember that families can and do recover together. Thank you.
Thank you so much, Pam. Thank you for all that you do. And thank you for the call to action that we can't have a recovery-oriented system of care. We can't have that fertile ground for recovery if we aren't including families in that it takes everyone and supporting the family as we support individuals affected by recovery is critical to changing the paradigm. Thank you so much, Pam.
You're welcome. Thank you.
I'm going to put a call out there and see if either Senator Abler or Representative Frederick is in the house. Either one? Senator Abler? Representative Frederick? Okay, well, stay tuned. Hopefully we'll have them pop on in a second. As we think about that continuum of care and all aspects of recovery, it's also important to think about having recovery-friendly places to live and a robust system of recovery residences. And I've invited Eric Smaystad, a manager of a recovery residence, to say a few words today about the importance of that. And Eric, are you available? Would you like to say a couple words?
I am.
Great, thank you, Eric.
So my name's Eric, and I'm a recovery house manager for Spirit House. So thank you, everybody, for letting me participate in this and say a few things. And Pam, I really appreciate when you talked about the language that can cause harm in recovery, and that's why I don't use words like sober housing, because I've been sober. So I like recovery. And I won't go into a lot of my journey because it's similar to many people who have addiction and alcohol problems. I could just let you know that it was very painful. And I've been to treatment, all those things. What I missed was trying to find a new way to live in recovery, to recover my life, to recover my family, to recover my children, and all those really important things. Not so much the material things I may have had prior to my addiction. And now as a recovery house manager, I was given this absolutely great opportunity, not to be a manager of a house and control things or tell people this is the journey we have to go on, but to actually be a part of the house, a family, and go on a recovery journey together. And my job isn't to be punitive. My job is to be supportive. And I've learned so much just through the recovery community, and thanks to Minnesota Recovery Connection and all the people that are on it today from there, I've learned so much and it's changed my life. But when I came to a decision, because I was dying from alcoholism and drug addiction, and I didn't want to die anymore. And I made a decision to go into detox, which was an absolutely phenomenal experience. And what made that place great, which was Gateway of Recovery, is it wasn't just 72 hours and go home. They actually spent some time to help a journey start to happen. Tried to get some aftercare immediately. I went into outpatient, and I also chose to do sober living. And what it's taught me here in this house is how to live. And what I mean by live is I live by 12 really simple things today. And they're guidelines, not rules in our house. I hate the rules and I hate expectations, but the guidelines for success in our house are real simple for us. It's honesty, hope, faith, courage, integrity, willingness, humility, brotherly love, discipline, perseverance, spirituality, and service. Giving back to this great community of recovery that we have in Minnesota. I have the exceptional, the great opportunity or this fulfillment I get from Minnesota Recovery Connection, where we make calls to people in recovery just to say, how are you doing today? And sometimes they're not the greatest calls, but they really are, because we're helping someone. And some of them are just fabulous calls where they share their successes. And I take that experience that I get with those people and I bring it into a recovery house. And thanks to people like MASH and March and NAR that have set up some guidelines for us to start to recover our life through, which are very simple things to live by. My life is something I've never expected it to be at 50 years old. And I've been through the old way of thinking as a youth, where mental health was a big part of my problem. And the solution back then was Woodland Hills chopping wood, Lionel Lakes Detention Center, things like that. And that didn't work. What's worked for me is getting my family involved, getting myself involved in the recovery community, but really the sober living and the fact that there's places like, when I looked at all this, I looked, where can I find resources? And MASH came up, Minnesota Recovery Connection, and there was a list of places that I was able to really investigate for my journey and choose which place I thought is going to be a recovery house or community. And I'll tell you, I've seen miracles in this house. I've seen people get their families back that they never thought they would. I've seen marriages saved. I've seen children come out of CPS and back to their parents. And that's the community of sober living. Is we have a meeting every Sunday. We talk about our week. We talk about a topic. We talk about our successes, our failures. And then it's funny, but a bunch of grown men get together and clean the house. And that's a team building thing that we do at the house. And after which we have a dinner, just like we would as a family. We sit down at the table and we talk and talk about recovery or joke or just what a family would do. You know, we're a bunch of men being intimate on a level of recovery that I've never understood in my life until now. And I couldn't do it without the resources that are out there, but more importantly, without places like Minnesota Recovery Connection, Elite Recovery, but places that truly cared about the journey that I was on and helped support that journey. Are there things I would change? There's obviously some things out there. I would love to see it when people go to treatment, that somehow they can get financial help to move into a recovery living situation instead of having to rely on so many things or get stressed about it, because it's a great opportunity to teach us a new way to live. And that's what recovery is. It's a new way to live. And not so much about just getting rid of drugs and alcohol. But
Thank you
that's kind
so
of mine.
much,
Yeah.
Eric. We've got a couple legislators waiting in the wings here. So I just want to thank you so much for sharing your passion and for sharing all you're doing in your recovery house, and by giving back, by helping the people that you live with sustain and seek recovery. And we just need more fabulous recovery residences and more people like you to bring that recovery home. Thank you, Eric. Really appreciate it. And I want to make sure we can hear, I think I saw that Senator Abler and Representative Frederick are both in the room. I'm not sure who has to leave first. Maybe we can do a coin toss. Senator Abler, maybe?
Or if you don't mind, yeah, I've got a hearing at the chair. Can you hear me?
Yeah, we sure can.
Well, thanks, and I'll be brief. You have, well, I'm privileged to be associated with this community, and I just was doing my own math, and I'm 5 months. Let's see, 5 months, 15 days, and 40 years free of chemicals, and I made it for lost time and a younger time. So I was glad to actually get through all that. And so it's it's a long time ago, but I haven't forgotten. I've lost some friends, and so I appreciate that. And if you've been listening to our hearings, you've all been making a huge difference in the tack of the Senate on where we're trying to go. If you've watched, this is a guy, you see him there. This is Jake, and none of you probably knew Jake. I met his mom, but all of you know a kid like Jake. I think he had 12 treatments and then took some blue pill, and that was the end of him. And that was quite provocative as I met his mother on Zoom on March Day at the Capitol, or that week. And so I'm trying to push, and I need your help. But what we want to have, we have all these bills that we passed. There's binders full of legislation and books of laws that tell the department how they have to do their work. And after a while, it's like, hey, I didn't check the box. And so, but what about Jake? And the tragic news is we can't say no more Jakes, but we can say fewer Jakes. And that's what I'm committed to. It may sometime we have the last one of those, but that's the commitment I have in the Senate, and in a huge collaborative effort on our whole committee. There's no partisanness in this. We are absolutely working together with Senator Hoffman is leading the way, and Senator Murphy, and I know I'm listing my members, but all the members are really interested in this. And so we want to make sure that you all succeed at this. We're talking about ways to make the recovery community organizations more effective, maybe make DHS more effective, and take substance abuse out of the basement and onto the main floor of their operational structure. Getting some pushback from the department about that, but it's the right decision. But at the end of the day, please, through whatever means you have, keep talking to us legislators about things that have hampered your recovery because of some foolish rule or some piece of paper that got in the way of you not being him. And so no more Jakes, please. And we got your back. We love you, and every one of you. Just it's a day at a time. And I pray God's blessing on each of you as you take one more step at a day. So thanks for the opportunity. Thank you.
Thank you so much, Senator Abler. And you missed Pam a little bit earlier, shared the story of Jake. And she sends her best to you through the chat there.
Oh, yeah.
But we really appreciate your leadership and your support. And thank you so much.
Oh, yeah. Thank you.
I'll turn it over. Representative Frederick, are you in the room?
I am.
Great. Well, welcome. We'd love to hear a few words from you as well.
Sure. I will be brief. It's one of those days where there's always like 3 different things going on at the exact same time. Yeah. And so I was not able to hear people's stories that they were sharing prior. I did hear a little bit of Eric speaking, and when it talks about, or when he spoke about community, that was something that really stood out to me, because I think of how impactful that is to all of us in different ways. I think of a time that when I was first leaving high school, I went out to the East Coast and I joined AmeriCorps for a year. And I lived in a house with 10 other men, boys, really. I mean, we were like 19 to 23, we were young. But I was scared. It was the first time I had left Mankato, where I'm from. And having that sense of community where we also would have cleaning days, things that would bring us together. We would try to share meals. I think of all of those things, of how meaningful it was to me at the time. So I think about how much there is overlap across all of our worlds in that those things have value. When I was approached to carry the legislation in the House this year, I learned last year to ask lots of questions before agreeing to anything. But as I started asking questions about what's the goal of this bill, what are we looking to do, and I heard about all of these different things, one of the things that stood out to me was housing, and that community support piece, and that I can't think of how ridiculous it is where we say, oh, someone completed, treatment, see you later, off you go. We're going to give you exact 0 supports and yet somehow expect somebody to be successful. Like, how ridiculous. And so to take this legislation this year through the House that looks at housing, it looks at food support, it looks at transportation, daycare, like a holistic approach to people's real life experiences. And I'm like, I don't know if anybody ever sees those videos where somebody's taking their credit card and like tapping it on their camera because they're like, I want one. When it came to this legislation, I was like, yeah, yes. Because I thought it did so much that would really have a positive impact on people's lives. Similar sentiment to what Senator Abler said too, that there are challenges with this. They're working with the Department of Human Services to see what's the most effective way to implement some of this and some of the challenges that they are expressing. But I will say this, even with all of the challenges that they are throwing out, everyone is on board with what we're trying to do. I have conversations with social service professionals down in my area, down in Mankato, again, people that might be implementing some of the programs that we're looking to put in. And they're all like, yes, we need more of this. And it's so great to hear that everyone wants to make it work. And it's more of questions of how do we make this work, not whether or not it's needed. And some of my colleagues across the aisle were talking about with this legislation that it could be some of the most impactful legislation that we have passed in many, many years. And so it's a privilege for me to have my name associated with this, to be able to push this through the House. And I just want to say thank you to everyone who has come together and to show your support, to voice your support for this. And if there's anything more that I or anyone else can be doing, or if there's other issues that are important to people, I would ask you to reach out. Some of the best things that I can do is not talk and just listen. And I try to do that as best as I can. So thank you for the time today.
Thank you so much, Representative Frederick. Really appreciate the work that you're doing and your support. I did put the link to the slides I shared earlier in the chat again for those who have joined recently. There are some links in there on how to contact your legislators, and it's so wonderful to hear that we know you want to hear from us. And so I also invited Representative Frederick is from the Mankato area, and we are fortunate to have a very robust recovery community organization in Mankato, WeCovery, and the founder and executive director, Brandy Brink, is here today to really speak to the role of recovery community organizations in filling a lot of those gaps in the system of care. And Brandy, are you here at the moment?
I am here.
Great. I'll turn it over to you to say a few words. Thank you.
Thank you so much. And thank you for everyone that shared. How is my volume? Everyone hear me good? A thumbs up? Okay, awesome. Hello, everyone. My name is Brandy Brink. I am a woman in long-term recovery. I am also the founder and director of WeCovery, a nonprofit recovery community organization located in Mankato. WeCovery is a grassroots organization that was founded as a result of a need in my community. Today, I want to tell you more about the work, the unique ways we serve our community, and the broader work of recovery community organizations that is so integral to the culture of recovery across our state. WeCovery provides recovery support services across 20 southern Minnesota counties. We help fill in gaps of service throughout each of these communities and work across and through many of the systems established by our state. What is unique about our work and the work of RCOs is that we are independent of these systems and have the ability to work with the people regardless of their ability to pay, regardless of where they live in our state, and despite any other program they may or may not be in. Through our unique structure, we are able to move through systems alongside those we serve. Our independence gives us the ability to experience the system alongside them, often seeing the successes, the failures, and the gaps of our current system. As an RCO, we have the independence to fill in the gaps we observe and not recreate them. For many RCOs in Minnesota, our work is a result of personal investment, both of time and of money, simply because we saw a need in our community and we stepped up to meet that need. The grassroots peer-based work makes RCOs highly unique, and my organization is here today as a result of years of advocacy that has gone on before me and made it possible for organizations like mine to grow. RCOs work in many different settings to remove barriers and support people. For example, we may be introduced to an individual through our local emergency department. Here, we are able to provide recovery support to them in that moment and also provide long-term peer support services in their next steps. For example, applying for health insurance, getting into residential treatment, developing a long-term plan, even after they've been discharged from the hospital. Most importantly, if and when an individual chooses to change service providers or their service ends, they do not lose the support of an RCO as an independent provider, committed to the community and committed to them. Our organization has helped provide a continuum of care in partnership with 245G facilities, social services, schools, employers, jails, EMS systems, hospitals, clinics, probation, housing providers, as well as several other organizations and agencies and the community at large. RCOs are structured in a way to provide services that are different from these structures. Our work is boots on the ground and embedded in our community. I have valued the flexibility of an RCO, the flexibility an RCO has, and have truly been able to meet those we serve where they are without constraints. RCOs provide support for many pathways of recovery, meaning there is no right or wrong way to recover and no right or wrong way to walk into the door of recovery. Recovery from substance use disorder is a process that occurs over time in our communities and across all systems. Historically, there have been many barriers and gaps on the path to long-term recovery for too many people. Recovery community organizations like WeCovery and others around the state are here to help remove those barriers and fill in those gaps, working not just with individuals, but with families, neighborhoods, and whole communities. Minnesota is facing the worst addiction crisis in its history, and the need is now to invest in an infrastructure of recovery support services, including RCOs, so that the path to recovery for all who seek it is free of barriers and without gaps. It's been my pleasure to share about our work today, and I'm proud to continue to spread hope of recovery with all of you, alongside of all of you, to all of those we serve recovering in Minnesota. Thank you.
Thank you so much, Brandy, and thank you for the amazing work that you do. And to all of the RCOs in Minnesota, we currently have 17 around the state, from Duluth and Moorhead and Bemidji to Mankato, Rochester, St. Cloud, Hastings, the Twin Cities, and we wish there was one in every county. So we need 87 at least, and part of the ongoing continuum of care to really stay with individuals and connect them to the supports that they need. We're really appreciative of the support of the legislature last session and the ongoing partnership with DHS to really build recovery community organizations around the state. And so as Brandy mentioned, one of the things that RCOs do is they work with individuals no matter where they are in the system, including individuals who may currently be incarcerated or are on parole or navigating different aspects of the system. And so today, Adrian Padilla is here to talk a little bit about the need for recovery support for people who have been affected by incarceration. And Adrian, are you here?
Yes, I am. Thank you, Wendy, for the opportunity. I'm grateful today that I'm part of this community, and I'm very passionate about what we do here at Minnesota Recovery Connection. I am a licensed alcohol and drug counselor. I am a forensic peer recovery specialist, and I had 10 years of continuous sobriety. And I was talking to my mom this weekend, and I've heard a lot of the pain from the mothers and the fathers and the brothers and the sisters and everybody involved, and how they've been affected, or how they might be not having someone in their lives who was very significant to them. And that's where I was headed. All right. And so in talking to my mom this weekend, she was grateful because she acknowledged the fact that my move from Florida to Minnesota, as far as way as I could, though painful for her, it was probably that I could have made, because it was time for me to do that. And when it boils down to right, and then all the support that I've gotten. In addition, I could feel her pain. I could hear her pain. As a result of all the things that her, but she was also grateful. I'm involved with, works with the justice involved population. We're all dealing, these are all human beings, right? We've made mistakes. And when is it going to be enough? When is that dark gray cloud going to be dispersed, with someone who's had a history of legal involvement, and then they've done everything that they could to change their lives, to educate, to move in a different direction, to be passionate about helping others save lives. And so substance use disorder is a term that we use now, but, we used to use addict. We used to use a lot of these things, and some people still do. So when are we going to stop using felon? When are we going to stop using, all these terms, because words are very powerful. When are we going to look at that as well? And start giving these individuals, many of whom are very talented, very intelligent, and have many skills and potential. When are we going to look at that? When are we going to tap into those resources and help those individuals transfer from involvement with the legal community and legal involvement into recovery community and a system, and empower them and have the potential to become, rather than what they've been in their past, right? It's really important. So I'm grateful to say that I have some of those participants that are in that situation where they become engaged and they're willing to move forward and are asking for help. And so I'm grateful that we have some legislators and people in those positions that can hear our voice, right? Because after all, we're all humans who make mistakes, all of us. And so, we're not necessarily the mistakes that we've made, but we should be looked at for the potentials that we have to develop and to help others and to save lives. Let's come together and do that. Thank you.
Thank you so much, Adrian. And thank you for the work that you're doing and for sharing your story. I think we lost a little bit with the internet connection, but I think everybody got the gist of the passion Adrian has and the work that he and others are doing. I love what you said, Adrian, about the potential to become rather than what we've been. And that is what recovery is all about. So really appreciate that. I want to bring in one more speaker to say a few words. We've had a lot of conversation about the continuum of care, a continuum of recovery, a recovery-oriented system. And a recurring theme throughout that is that there is no wrong door to recovery. And there are a few people I know who are as passionate about this as Mohana Kakish. And Mohana, would you like to say a few words?
Sure. Hi, everyone. I'm Mahana. I'm an overcomer, and I'm a person in long-term recovery. Pathways. That's what we're talking about. And then we talk about barriers. And I think where the barrier is in recovery is a stigma. that is the barrier, because when we have that stigma, it can stop a person who's in recovery down that path of recovery. And so I started doing TSR calls with Minnesota Recovery Connection in my recovery, because I wanted to reach out to people more. And I'm a person who learned in my recovery, you get to be happy. And so when I did that, I became a certified peer recovery support specialist. And then I learned about criminal justice. And then I decided to become a forensics peer support specialist. And then I learned about, and then what really got me is I realized a lot of people who are struggling in recovery, and you notice I use the word recovery often. I don't name people. If they want to do that, I support them where they're at. But that is not my place to be naming someone. If they want to do that, I am there to meet them. And the reason I've learned these skills is because, I got trained at Minnesota Recovery Connection with Caddy and her team. And then I decided to become a certified peer support specialist, because we talk about, I say mental health, but I really use mental wellness, because we can all get well from that and continue to have our recovery. And so then and recently example, because I took some time in volunteering, and I also, I have a radio show called The Rise Up Hour, and I have people of many forms of recovery that come on the show. And something that we gotta not forget about is I've also realized that cultivating relationships with allies in recovery is really critical, because that helps change the stigma of recovery. But last week I was on, I was making calls for TSR calls. And what I love about the TSR calls, it reminds me of what's so important about those, because these are people who want to call every week and they're in long-term recovery. And most of the time, they're always such pleasant calls. I mean, and they're doing great. But oftentimes, maybe they're stuck in their recovery or don't know where they're at in their recovery. And they're experiencing maybe a moment of emotion that normally they wouldn't get this, they wouldn't know this. So what do I get to do? I get to offer these amazing free services that MRC offers, and that's a recovery coach. That's one of the first things I go to. And they say, and often they say, what is that? Or we talk about an all recovery meeting. And I'll tell you what, someone is on a pathway and they decide to take a different road. There isn't one golden road that takes you to this big castle and says you're going to be having all these things. What it allows them to do is take a different path and offer them these different services so they can have a continuum of recovery throughout their lifetime. Because what I've learned through all my through all that I've done in recovery and support those and done this is I have learned that that recovery is recovery to me is saving everything. And the reason I say it's recovery is saving everything is that stands for RISE. And I don't say everyone, everything, because it saves communities, it saves organizations. And what it does is it can allow a person to know that on their path, they have different methods of choosing, because it always used to be just one thing. And now we got to realize we are in an opportune place to continue to have these different pathways. And I think that's why it's so important for legislation to know that it's so critical for us to keep thinking outside of the box, because we can't stay within the box. And that's why I've also become a Cerebral Hope Network trainer and decided to be on some committees, because recovery is life, recovery is hope, recovery is a beacon of light for everyone. And thank you so much.
Thank you so much, Mahana. We all need to just grab onto that passion and take it with us back out into our communities. This has really been an extraordinary afternoon. I so much appreciate everyone joining us today for Recovery Day on the Hill. And the takeaway message is recovery is everywhere. And we're all here to fight, to advocate for recovery as being a normal part of the continuum of care, that it is beyond just brief interventions, but at every step of the way for everyone who is seeking a life in recovery. And I'm grateful today that we were able to honor Mark Jonigan. Thank you again to Gregory for sharing those passionate and powerful words about Mark and his legacy for recovery advocacy. A huge thank you to March, John Magnuson and Amy Delwo, and for all the work that March is doing legislatively to try to improve and extend the system of care. We had wonderful legislative speakers today, Representative Baker and Senator Eaton. Completely my fault that we missed Representative Hassan. I know that she will be back at another time, and I want to thank her for her work in supporting recovery supports within the East African community, which is so much needed at this time. A huge thank you to Fahia Badul and the work that she's doing, and Bobby Eagle with the Mille Band of Ojibwe and the Anishinaabe support services that he is working on, to Eric and his work with recovery residences and his passion for making recovery residences, recovery homes, a place for healing and recovery, to Pam and her work with Thrive Recovery and her passion for bringing recovery into families and leveraging the power of families in our recovery journey. Big thank you to Senator Abler and Representative Frederick for their work in supporting March's legislation this year. And to our final speakers, to Brandy and all of the other recovery community organizations around the state who are growing recovery within their communities, whether that's Recovery in Mankato, Face It Together Bemidji, Recovery Alliance Duluth, Doc's Recovery House, Recovery is Happening in Rochester, and so many more. And to Adrian and Mahana for your passion in speaking to all pathways of recovery and to supporting individuals, no matter where they are in their recovery journey. We heard so much today about changing the paradigm, shifting the narrative, and moving forward in a way that brings everybody along on this path to recovery, which we know is possible. So thank you, everyone. I'm going to put the slides one last time into the chat here. We heard a lot of issues today, and please contact your legislators. We're all passionate about different aspects of recovery, and they want to hear from you. That's the message we heard from our representatives and senators. Oh, I just think I sent the slides to Kate and not everyone, so I'm going to send those again. Have a beautiful day, everyone. Recovery works, recovery is possible, recovery is everywhere. This session has been recorded. MRC will share it on our social media in a little bit, so you can share it with others. And if you weren't able to be here for the whole Recovery Day on the Hill, you'll have an opportunity to sit in. So big thank you to all of our speakers. All right, have a beautiful day. Until next year, get out there, advocate, contact your legislators, and share your passion. Thanks, everyone.
And thank you, Wendy. Have a great day.
Thanks, Wendy. Oh, Wendy's gone.
Just missed the last split second.